blood pressure BP, HR heart rate, BMI body mass index, HX history, TX treatment, BD twice a day दिन में 2 बार, OD once a day दिन में 1 बार, TDS thrice a day दिन में 3 बार, QID 4 times in a day 4, NPO nothing by mouth मुंह से कुछ नहीं लेना, NAD nothing abnormal discovered, LOS length of stay duration of hospital admission, stat immediately, PRN as needed आवश्यकता अनुसार, EDERA emergency department emergency room, ICU intensive care unit, NICU neonatal intensive care unit, HDU high dependency unit, RN registered nurse, OR operating room, RBC red blood cells, WBC white blood cells, BX biopsy.